Good morning, hi. My name is Irene. I had my diagnosis about 4.5 years ago, at the start of the pandemic.
Hello, I'm Malebogo. You know me already. Hi, Liz. Nice to meet you. Well, I had my diagnosis in October, so I finished surgical treatment, but I'm still on the other side of the treatment plan.
Hi, my name's Liz. It's nice to meet you both too. I had my cancer diagnosis 5.5 years ago, and I didn't have any treatment other than hormone treatment.
So 4.5 years ago, I was actually going for my screening, and my nurse at the time, at the end of the session, said, do you check yourself, Irene? I said, I wouldn't know where to start. Being a bigger lady, I didn't know what a lump and what is a bump. I'd had my mammogram about 18 months ago, and relied on my mammograms, and I never ever checked myself. And my next mammogram was going to be in another 18 months' time. Anyway, she just said, just have a go, just do it. Have a look online, see some of the self-examination videos, and check yourself. And I went home and I didn't do it. And then 2 weeks later, I decided, why don't I? Why don't I do it? So I had a shower, sat down, and unfortunately found a lump straight away. And obviously it was vitally important to kind of get to the doctors as soon as possible. So which I did, and obviously the self-diagnosis was the bit that saved me. If I'd left it for another 18 months to my next mammogram, things might be very different now. But what about you? What about yourself, Malebogo?
Oh, thank you for that. Yeah, I was one of the lucky ladies because the NHS protocol is that when you reach 50, you might be called for a mammogram. Between 50 and 53, expect to be called for a mammogram. However, they called me when I was 50. And I ignored it. I ignored the letter. I think the reason why, on reflection, the reason why I ignored it was that I hadn't had anyone that looks like me say that they've had breast cancer. I hadn't had anyone in my family, friends, no one that was close to me had breast cancer. So I had no reason to suspect that I might have it. Ignored the first call. The next year, they sent me another letter to say, come in for your mammogram. I was going home to Botswana on holiday. And I was like, well, I need to buy my friends and family presents. I'm really busy shopping. So I contacted them to say, I'll be in touch when I come back. And put the reminder on my calendar to call them. So I came back, went back to work, saw the reminder on my calendar and moved it to the next week because bad luck, emails, everything was overwhelming. The next week, again, moved it to the next week. By the time I got to the third week, I just skipped it and didn't go. Then the third year, they called me again. And this time, they sent the letter. And this time, on the day, they called me to say, we're expecting you today. So, luckily I was working from home that day. So I dropped everything and went, only for them to do the mammogram and said, oh, we need to do an ultrasound scan. And I said, today, does it have to be today? Because I'm busy, I'm at work. And they said, please, if you can today. They did the ultrasound scan. And then they went on to say, oh, we need to look at this properly, and did a biopsy on the same day. So as you can see, the National Health Service, on that part, they were great. And 2 weeks later, they confirmed a diagnosis of left breast cancer, stage 2 invasive cancer. How about you, Liz?
I am very good at putting things off, but I've never put my mammograms or any other smears off. I've always done it, and I went for a routine mammogram, not expecting them to find anything because I couldn't feel anything. And I was quite shocked when they told me that I'd got cancer in both breasts, almost certainly, although it could be shadowing. And I said, could it? And they said, not really. So I too had the biopsies and extra mammograms and all sorts of things. And then after seeing the consultant, I was admitted to hospital, and I had bilateral mastectomies and chose not to have implants and just carried on with my life. I was quite fortunate. My time in hospital, I thought it very strange that I was admitted to Hurstwood Park for the surgery, which is a neurological hospital, or was, and was there for the day, and then admitted to an orthopaedic ward overnight. It was a bit confusing, but all in all, the care was really, really good, and I'm glad I went for my scans.
It's so important for self-checking. I didn't do it, and now realise that's the bit that certainly saved my life, and the life that I have now. You know, I relied on my mammograms, but they're 3 years apart, as we know. But obviously, ladies under the age of 50 that don't get a mammogram. So actually, self-checking is so much more important, and getting to know all your lumps and your bumps. And then being more aware of your breasts, and then if something then does change, you go to GP and just get it checked out. You know, that would have been so much better, you know, if I'd done that. But the fact that I did it and found it when I did, that was so important to get it done. Find it straight away when I did, and then that saved my life. How about yourself?
Yeah, I mean, I just shared with you that my diagnosis, my condition was picked up by the Park Breast Care Centre. Before then, I wasn't checking my breasts. I wasn't thinking of breast cancer and me, or anyone who looks like me, an African black lady. No, I didn't. Let alone that men also can get breast cancer. So that awareness, I suspect is something that needs more attention, especially in my community. But also, taking your breast saved your life. However, in my case, it really needed to be the mammogram. I'll tell you why, because after they did the mammogram, they then thought something was not right. So they did feel my breast to see if they can feel anything. The professionals couldn't feel anything. So it gives me very little confidence in my own checking my own breasts. But that's something that I'm building up. Apparently, if you check regularly, you will get to know your breasts, and then you will then be able to identify what's new. So I'm working on that in between mammograms.
I know for a fact that if I hadn't gone for my mammogram, there would have been no diagnosis, because there was And the radiologist and people that did the biopsy said that I wouldn't have been able to feel them. I'm not going to say I was a regular checker, because that would probably not be true, but when I did check, I never did feel anything. In the past, when I was much, much younger, I did have a biopsy of a lump, and the response was, "You've just got lumpy breasts," which is hard, sometimes hard, but that's why it's important to check so regularly. I think they say having a shower is quite a good thing, because when you're soaping yourself and things, it's easier to feel. I'm just very grateful that I did have the mammogram. I did go, and I did get things picked up that could have spread much further. So I'm very grateful.
Between us, there's lots of things there that we've covered. As if we've all, self-checking and having a mammogram where you're able to is so important.
Yeah, and obviously, if you are under 50, because then you don't meet the NHS criteria at the moment for the regular mammograms, I would say, yes, it's important for the younger people to be self-checking and then getting used to their lumps and bumps. And if anything seems different, because it could be life-saving to investigate it, just to go to your GP. That's what they recommend. Check if there's anything different, go to the GP.
That's the important thing, I think. Still many people think that it can only be cancer if it's a lump, but other changes to your breasts, like nipples inverting or discharge and things like that, they equally can be a sign of cancer. So it's important that any changes in your breast are reported to your GP, not just lumps.
Exactly, whether it's kind of puckering of the skin, an abnormal shaping. There's looking on here. There's the quadrants of how of things to look at. Of where percentages of where lumps or where cancers are actually found. And obviously the breast is not just the breast. The breast goes, under your armpits and up to your collarbone. So, there's a lot of area, to get familiar with.
Yes, indeed.
I received my first letter from the National Health Service prompting me to attend breast screening at the Park Breast Care Centre when I was 50, and I didn't respond for the reasons that I've already shared. And then when I was 51 again, they invited me. I didn't respond. The third time round, they invited me, but they also followed it up with a phone call on the day in the morning to say, "We're expecting you today." Thanks God I did. That telephone made a difference, because it really did prompt me to attend. And that was October last year. And the first thing that they did was to explain what the mammogram experience will be like, which was very helpful, because it really helped me, relax and before the process. Do you remember when you went for your mammogram?
Yes, as I said, when I went along and with what I thought was a lump, they were really, really good. It was very, very quick, so you're taking off your top and obviously your bra. So you just going into this room, and then there's this machine, this cold machine. And the lady there was so, so kind. And I just remember putting my boob onto this machine and it being clamped down, which it might be a bit uncomfortable at the time, but actually, it took about 2 minutes, and then they just took some photographs and then they take it off. It was quite an easy process. But they described what they were going to do. They told you, how to do it. They helped you positioning yourself in this machine. But it was absolutely fine.
Yeah, I remember when I went. It's a bit of a bad situation because I just thought I'll be in and out, and it was quick and comfortable, quick and easy. So the same process, a machine in the room, and then before you know it, it's done. And for me, they had found something that they needed to investigate
yes, I know
further.
That feeling. I knew that, but what I found when I went there was in the waiting area, all the ladies were talking to each other, and for example, there was a lady with Down syndrome, and I must have looked sympathetic. The person that was with her asked, after I came out, asked if I would speak to her and tell her what happened, and that for me was the nicest thing about being at the Park Centre, was other ladies having their mammogram and talking to each other.
We're all in the same boat. We've all got the same things. And
I think that makes a huge difference. And my mammogram was just, for me, that day, like any other one I'd had done, until they looked at it and told me.
Yeah, the other thing is just being at that centre. I was like, oh my God, so many people are going through this. And also young people as well, which made me think I need to talk to my daughter about this, So that helped me really
it is,
to see that I'm not the only one. I'm not.
Exactly.
They had me wait for them to look at the mammogram results, and then came back and very kindly explained that they have found what they described as calcification, which they then prompts them to look into it a bit more, and that will need to be an ultrasound scan. I wasn't very keen to have the ultrasound scan because I was in a rush. I wanted to go back to work. But they said it's very important that we do it today. It won't be long. They persevered with me. Let me just say they persevered with me, and I'm grateful for that. And we did the ultrasound scan. And after that, they took it to the doctor or the consultant at the time, and came back and said, I'm afraid we're going to need to do a biopsy to test this, and we can do it today. So they really were very responsive. The fact that they did all these tests, including hand manipulation and testing for any lumps themselves, I appreciate it, and I think they need to be. I think it's a plaudit to them. I need to give them a plaudit. I'm still planning to do a big plaudit for them to say that thorough, the fact that they were persevering and thorough, and so that care made me so comfortable to carry on with them. It's life-saving. So once I was diagnosed in October, then 2 weeks later, I was screened in October. 2 weeks later in November, I had the diagnosis. And then in December, I was on the operating table for surgical treatment. So I had left lumpectomy. And then in January, I was called back for widening of the margins, because once cancer has been removed from your breast, as you know, the next step is to test the sample that has been removed around it to make sure that what is left in your breast is all clear. So if any of your breast, of the mass that has been removed does not have any clear margin, they have to correct that. So I had to go back in January for them to open again and do it more, remove more. And that in the end they had removed 88 centimeters. So it's quite big, and yet was not able to be felt by anyone. So the surgical treatment was finished in January. The breast care center continued to look after me throughout post-surgery. They helped me with wound care. I have a cancer nurse specialist that checks on me, not only about physically how I'm coping, but it's also the impact on my mental health. And I have a specialist consultant as well that, is responsible for my post-surgery treatment. They explained all of my options very well. Professor Blumenfield, he's amazing, and prescribed radiotherapy and zoledronic acid and tamoxifen. So I finished radiotherapy treatment. I have had my second lot of zoledronic acid, and I am almost 2 months into my tamoxifen hormonal tablet, which is a tablet that helps prevent recurrence of breast cancer. So that's where I am now with my treatment. Have you finished the surgical treatments, and where are you?
Mine's completely finished.
Oh, okay.
Because it's 5.5 years, and normally the hormone treatment like tamoxifen or anastrozole or letrozole or whatever is usually for 5 years. Certain ones of them, tamoxifen protects your bones, but the other two you need to take calcium and vitamin D with, so there's 2 tablets to take instead of 1. But I think it's very important that how did you find the radiotherapy?
The care that I got from the professionals was generally great, and they are specialists, and I felt confident in their care. I had one session where there was someone who was newly qualified with another person that was very experienced. So the offer on the day was for the newly qualified to have a go with the help of their colleagues. So that session was a bit hit and miss, but they got it right in the end. And I appreciated it, although, it's very good to be on the other side, because I'm a health professional as well. Yeah. I'm an occupational therapist, and I have been the student or the newly qualified needing this kind of experience for me to build the confidence and.
Did it affect you physically in any way? Did it make you tired, or did it make you uncomfortable?
I was tired. Your skin changes. It's almost like you've been bent around the breasts, but I was aware, and I was advised on what to do to help that. So there's certain moisturizers that can help with that, and that was fine.
Oh, that's good that they gave you the advice on how to manage it.
Yes.
That's good.
Yeah. Certainly from what you're saying, it's the fact is you're not alone. There is support out there. The Park Clinic is so good. They are really, as you say, they're really supportive. They talk you through all of it. But obviously you've got obviously the Macmillan who are there as well. You are never alone through cancer, and there's always somebody there to help you.
You raise a very important point there, because I come from Botswana. I'm away from home. So in this situation, I had only my daughter and my granddaughter, who's just 10 years old now, and Macmillan Horizon Center. I couldn't have done it, been on this journey without them, because
I was a community palliative care nurse until I retired, and I fully understand that you saying that you never saw people like you with cancer or with these diseases that affect people because of your culture and how different it is. And I really understand you saying that, because I saw it as well, visiting people in their homes, how hard it is for people, and it's not always easy for the people looking after you to understand why you do things differently and why you put things off because you don't think it's likely to happen to someone like you, but it can happen to anybody, male, female, anything. And it's the importance of you saying that can't be underestimated.
There's so much support out there for anyone who's newly diagnosed, like yourself, Malebogo. Macmillan Centre certainly was a real big support for me. I was able to go there, and my husband came with me as well, and he got support as well. And actually, they even talked about financial advice, so they referred us to assistant advice. So there's lots of different kind of support, whether it's emotional or physical. I don't know about you, but I got acupuncture at the Horizon Centre just because I was in that space where I just needed some calmness in my life, and actually doing acupuncture was really, really good. So the Macmillan Centre, they offer so many different things, so many different services, whether it's reflexology, aromatherapy. They do lots of different things. And I think, what did you have, Liz?
I just sort of accepted that I'd had bilateral breast cancer and that I'd had bilateral mastectomies. So I didn't have really or need any aftercare as such, because I just took 6 weeks off work and went back to work. For me, because I'm widowed, my sons were really, really struggling because I didn't want to say anything until I knew for sure that I had cancer, because I didn't want to say, Mum's got cancer, and it wasn't. So they were rather cross with me that I didn't speak to them more about it. So I think, especially when you're a mother, you try and shelter people from what's going on around you. And they were very cross, and I wouldn't recommend it in future for other people. But, I mean, the park centre's there for you whenever you need it. I could, if I wanted to, go to the Horizon Centre for sort of psychological support as opposed to seeing a Macmillan nurse for physical support. Yeah. So, and there are lots of nice volunteers at the Horizon Centre as well that can sit and talk with you about anything you want to talk about. You know, sometimes people find it easier to talk to a non-healthcare professional, if you like, someone that can just listen and not sometimes giving advice. I've found people, they don't want to know, they just want someone to hear what they're saying and maybe acknowledge that it's real and not try and give people solutions, because that's the best thing about all the people at the Park Centre and the Horizon Centre. I know that professionally, that they're there to support rather than give solutions.
Exactly. I think there was also the offer of counselling sessions as well that they provide. And so kind of the journey, our journey doesn't stop after the operation. Yeah. That our journey carries on. And counselling, is an option for people, if they feel like that they need it. But it's actually available to all our families, and you can always go there. 4 years down the line, I can still go in there.
They've got a very nice cafe, haven't they? So you can just go for a coffee and to talk to people. Do you find that? Or
I was signposted to the Macmillan Horizon Centre as well. And that made my treatment a holistic treatment, actually. That's the thing that made it whole. Because, like I said, I'm away from home, which is Botswana, only with my daughter and my granddaughter here. They were very supportive, I have to say. They really were strong for me. But being signposted to the Macmillan Centre really filled that void, the family network void, that you then realize is not there when you are going through a vulnerable time. So with Macmillan, the first day when you arrive and they give you that the voucher for your free coffee at the coffee shop, that's very nice, very kind. And then the fact that you can walk into this lovely space with lovely views anytime you want to be around people that understand, it's great. And you can help yourself to cups of teas and drinks. And also, for me, I really did get a lot out of it, because my employer was supportive of my holistic treatment plan. So I was able to get counseling, acupuncture, massages. I attended the better eating for better health sessions. I attended the painting for wellness. I'm not a painter, and I didn't think I'm so creative, but that was a surprise at how relaxing it makes you feel, and how it incorporated breathing exercises into the painting. And that one of the sessions that I was surprised at how relaxed and anxiety relieving was that one. I've attended yoga, dancing for wellness, so a lot. I stopped just a month ago because I had to go away, but I plan to go back. And this is the beautiful thing about it. It's never ending, and it's also accessible by family. Yeah. I did let my granddaughter and my daughter know. They haven't engaged with the Horizon Centre, but it's good to know that when and if they feel they are ready to engage, they can. And you can visit physically, and there are some online options that you can do, like yoga, breathing exercises, etc. And also there's a group, the connection group, where a few people going through the experience meet. It's available every Friday online, and you can just join to listen and learn from others, or share your experience and support each other. Yeah, I found that very helpful.
And the helplines are quite good. Sometimes people don't want to see someone face to face or even know who it is. So to phone one of the helplines and talk to someone that you don't know and doesn't know you, that can be quite helpful for some people, can't it? Not everybody, but it's good to have all the options available on how to get support.
Nationally, I found Cancer Now forum, where everybody who is experiencing or wanting to know about breast cancer can just talk. So you don't know who you are talking to, but people are chatting on there, asking, I've just been diagnosed, it's a whirlwind. I don't know what to feel. Others can say, oh, this is how I felt. This is what you should expect next. I think, and they speak in layman's language. So I think it can be helpful to talk to non-professionals like that as well. So to be honest with you, if I was asked to give a key message from this experience, I would say the key message is that the National Health Service is brilliant. Park Breast Care Center, excellent. And then the surrounding holistic care that you get from the Horizon Center, Macmillan Horizon Center, is just brilliant. However, I am aware of people like me. Our experiences can be poor in the hands of the NHS. But I do think things are improving. So I would urge people, I know this can create a lack of trust, but for them to give the NHS a chance, because I think they are improving, things are getting better. There are still pockets of very poor behavior towards black patients, but it's improving. And it is life-saving regardless. So I would urge people to go for it.
Your key message was very important, to let everybody know that the NHS is available to them, and the staff need to learn from you as a patient how you would like things done and how much easier it would be for you if people actually listened to how you deal with things. And the other most important thing is to attend screening when it's offered and try to see it for what it is. It's a screening session that can help save your life.
For me, the biggest message that I would give to anybody is just get to know yourself. You know, early diagnosis is just so important. Checking yourself on a regular basis, getting to know your breast, whether you're male or female, just getting to know yourself and just realising what these are. It's so important. And then if you are of an age where you have having your mammograms, going for them, it can save your life. And the sooner that you can get a diagnosis, if there is something, if you check yourself and you find there's something different, go on to your GP. It might not be cancer, probably won't be, but just getting to know yourself so much better can give you a head start. And then if unfortunately something does happen, that early diagnosis is key.